show a minimally invasive procedures where we're going to kind of correct some transverse deformities in the toes. Now these can be corrected. Look from the top too. These can be corrected with open procedures, and a lot of times it's hard to correct these transverse deformities with open procedures without going into some fairly large surgeries and tendon transfers. So minimally invasive surgery is really good for toes. So what we're going to do for her, let me have you stand up so you can see how stand up real quick. So let's just see how it looks when you're standing. See, these types of toes can be pretty annoying. They see how it's trying to overlap her big toe. So everything's kind of moving medial. So what we're going to do, I'll show you what we're going to do. Come on up here. We're going to use percutaneous procedures to correct this. And the way we'll do that, we'll approach the toe from the medial portion here, and we'll go in with our burr and take a wedge on this side that pulls the toe down. Same thing with this toe and this toe. And then the fifth toe has a contracture to it that's probably just a tendon. Might get by with just a flexor tenotomy for that. But we do need to do a bone work on this and this toe, probably this toe as well, to straighten them all out. So if this is not done, it's going to keep going, overlapping her toe like that. Well, this is a predislocation type syndrome or plantar plate tear, what causes this. But you don't have to dress the plantar plate here. She's not having pain here. So everything with the toes on the top. So this, even though we do know we have some plantar plate issue, we're just going to get this where it fits in her shoe good. And a lot of times when we do these MIS procedures, osteotomies on the toes, we look at the ultrasound and we can see the plantar plate tear. And later on, the patients come back in, the plantar plate is back together. We're going to do that today. We're going to do a little plantar plate view here and show the tear. And then later on, we'll show how it heals after this minimally invasive surgery. Now, to correct this foot open would take probably, for most surgeons, at least an hour or maybe even a little longer to correct all this. For the minimally invasive procedure we do today, it won't take us but maybe 10 minutes tops to do this. So it's a lot quicker, a lot easier on the patients. This is going to be done here in the office today. So we'll follow up with her post-op too. Okay. Now let me ask you something before we start. Your pain levels now, 0 being no pain and 10 being just crazy, terrible pain. What is your pain levels on a day-to-day basis on this right here?
10.
So the 10 it
all
hurts.
the time.
Hurts all the time. So this can be very painful. So she says it's a 10. So this is on the VAS scores. We have a chart people can look at too. But we're going to kind of trace this out and the post-op as well. Now this foot, we've already done this foot, right?
Mm-hmm.
So if we did this on this foot and straightened her out here, this toe was over the top of this foot. And we did this with making a wedge. So we're going to do the same thing here. As you can see, she had previous hammer toe surgery there, but we took a wedge and pushed them back over. We're going to do the same thing for these toes, so there's not overlapping her toe like that. So how long ago was this done? This has been
Last year.
About a year. So this has been about a year. So these things hold after you do the osteotomies and get people out of pain. So how much pain do you have with this foot on?
None.
None with this. Now before we did this surgery, what was your pain level?
Not as bad as this one.
Okay, but it was still like from 1 to 10.
It was in worse shape at the time.
Yeah.
I wasn't having the pain.
Okay.
They do with
But this one's extremely painful.
Uh-huh.
Alright, so we're going to kind of correct this one today, kind of like we did this one, and go from there.